Well, welcome, everyone. We may have more people joining us. We had a number of people register, so hopefully they'll join us as we move forward. My name is Joan McGrath, and I'm the Executive Director of Plan of Massachusetts and Rhode Island. And I'm joined by Kathy Vitello, the Director of Operations and a licensed social worker. Okay, so today we're hoping to gain a deeper understanding of special needs trusts, learn the responsibilities of a professional trustee, and to understand why a special needs trust is beneficial to you and your family. If you have any questions during the presentation, please feel free to drop those into the chat box and we'll try and answer those at the end. So we'll start by who is Plan. Plan is a nonprofit 501c3 serving people with disabilities of all ages. We are what is referred to as a professional trustee. We do provide trust administration services to pooled special needs trusts and standalone or third-party standalone. We were founded by parents of children with disabilities. In the late 1960s, a group of parents got together and we were became a corporation in 1971. And so this year we're celebrating our 50 years in business. So our mission is we proudly serve people with disabilities, lifelong or related to illness, injury, or age, and helping to preserve assets, to protect benefits, and to live well. Our history dates back to the early 1960s when a group of parents who had children with disabilities got together to share their concerns, fears, and anxieties about the future of their children. They worried who was going to look out for them and advocate for those children. These fears, anxieties, and concerns continue to be expressed by parents of children with disabilities today.
Yes, so Special Needs Trust came into effect in 1993 through the Omnibus Budget Reconciliation Act, which is referred to as OBRA. And this was enacted by President Clinton, and it was a vehicle for people who had disabilities that were on public benefits or wanted to obtain public benefits to be able to put funds aside that were to be used to supplement their needs and hopefully improve their quality of life while maintaining all their public benefits. So as Joan and I go through what the Special Needs Trust is and how people benefit from it, we will refer to one of our beneficiaries, Jane. So Jane was in her 40s and diagnosed with autism, and she lives in a group home. And in her case, her parents supported her until they passed away. And in their estate planning, they took their life insurance policy and had it designated, and Joan will speak about this a little later, so that the funds from the life insurance would fund a special needs trust for Jane.
So types of special needs trusts that we offer. As I said, trust administration services for first-party trusts, which are referred to as D4As, third-party standalone trusts, and pooled trusts, D4Cs, which would also have a first-party and a third-party component. So to help understand, a first-party trust, which is a D4A, is one beneficiary, one trustee. For a third-party standalone trust, again, it's one beneficiary, one trustee. But for a pool trust, it is one trustee and many beneficiaries. And it's pooled for investment purposes only. So the funds are invested as a group. We get better pricing that way. But each individual person has their own sub-account. So their own sub-account, if money is taken out for Mary, that money comes out of Mary's sub-account. It does not affect anybody else's sub-account. So it's cost effective that way.
Right. So when we talk about first party or D4A, that means that the funds originated from the beneficiary themselves, whether they got a settlement or they had excess savings, whatever that case may be, it's the beneficiary's own funds. For a third party standalone or even a third party in the pool, That means somebody has put funds into a trust to benefit the person with a disability. And the other option, which is the option that Jane's parents used, was if they set up the trust and didn't fund it, it was funded upon their death. So they used their estate and their life insurance to put funds into this trust. So a special needs trust, it's, as we said earlier, it's a vehicle to, preserve your public benefits, but make sure that there's funds available to supplement your needs. As many people realize, public benefits don't cover everything, and there's a lot that they don't cover. So,
So to have a special needs trust, which we've talked about this before, you can't have more than $2,000 of your own money. And so, if you have money and you want to remain on benefits, then you really need a special needs trust.
right. So like your SSI, your supplemental social security income, and excuse me, Medicaid programs, they're called what we call means tested. So they're looking at your assets. And that's what Joan's referring to with the 2,000. If it exceeds that, then you're not eligible. In Jane's case, choosing plan as the trustee took the responsibility off of her siblings so that they felt free to live their own lives and do their own things. And it also helped ensure that the siblings had a good relationship. Even in a healthy relationship, you put money in the middle and often things don't end well. This way, siblings can be siblings and have a nice relationship, and somebody else manages the trust. So the beneficiary has to go to a professional, ask for the funds. And it's important that you have a very good understanding of the rules and regulations regarding special needs trust, the benefits, what will impact the benefit. As a trustee, we want to make sure that anything that comes out of the trust is never going to have a negative impact on benefits.
Correct.
So here at Plan, we're unique. And to my knowledge, I think we're the only organization that has service coordinators on staff. Our service coordinators are all licensed social workers, and collectively, there's probably about 150 years worth of experience in this office. Each beneficiary and their support person, could be a family member, could be a power of attorney or a friend, with somebody who supports the beneficiary, will work with their assigned service coordinator throughout the life of their trust. The service coordinator will meet with the beneficiary at a minimum of twice a year. Often it's more often than that. And they're looking at the person's needs, their benefits, their living situation, helping to guide to make sure that they're accessing everything that they're entitled to, and ways that they can utilize the funds to improve the quality of their life. So Joan and I have experienced many occasions where the parents' wishes aren't necessarily followed. There've been several cases where people set up this future funded trust and then they leave a family member that is executor and they decide that, we're not going to fund that trust. We can do a better job with the funds. This way, you can just ensure that your wishes are going to be carried out. So as we look at individuals that have disabilities that really rely on public benefits, there's some studies out there, some recent articles, and it shows that a person with a disability at a minimum requires approximately 28% more income, or about $17,000 more a year, to maintain the same quality of life of someone who doesn't have a disability. So your special needs trust is there to help supplement your needs, especially things that aren't covered by benefits. People who, we just went over this. So in Massachusetts, it's $2,000, but in the state of Rhode Island, which we also cover, it's a $4,000 asset limit for the means tests to be eligible for public benefits. And there have been times where people they don't do the estate planning, or they haven't thought about special needs trust, and the funds actually go to the beneficiary, or they get a settlement and they don't realize that it's going to have an impact. And it is very difficult if somebody gets funds in their hands and they lose their benefits. It's harder to get back on benefits than it is to initially apply for benefits. So according to the CDC, 24% of people have a disability in the state of Massachusetts. Disability costs and healthcare expenditures in Massachusetts are approximately 24.8 billion per year, or up to 30% of the state's healthcare spending. When we look at people in the trust and we're trying to help guide them, we're looking at current needs and anticipated future needs. So it's important to keep benefits in place for people. There was another article that was written, and I think Maria put all these citations up here for people. So it depends on the person's needs as to how much extra they're going to need. So one of these articles talked about a person who is going to need home modification, vehicle modification, uncovered medical expenses, additional caregiver hours, and additional educational needs. And it could be well over $400,000 a year to keep somebody at home.
So this is slides talking about ways to fund a trust. So, Kathy and I over the years have met people that feel that they can never die, they can't retire, they don't think they have enough money to pay for their child, or to plan properly. One way to set up to plan properly is to set up a future funded trust. Third-party trust is the best way to go, as it's not a Medicaid payback trust, and the donor of the funds can decide how the money should be spent. For life insurance, you want to be able to set something up where you can pay your premiums and then assign the beneficiary designation to the third-party special needs trust for the benefit of your loved one. So, but other ways would be through settlements, inheritances, retirement, savings, and sale of a house. So if it's your own money, as Kathy said, it would be a first party. If it's the money of someone else setting up a trust for a loved one or a family friend or whatever, that would be a third party. So hopefully you know a little bit more about special needs trusts and the importance of them. What we'd like to talk about is picking the right trustee. So we are professional trustees. You can pick someone to be an individual. As Kathy mentioned, we talked about family members, and often the money in the mix causes strife between the family members, where you have one person asking another person, and maybe the aunt doesn't want to say no, but if she says yes and the money is dispersed, then it could impact the person's benefits. So a lot of knowledge is required to make sure that you pick the right trustee. So as Kathy said, what services are needed now and what will be needed in the future, what technical skills and knowledge are needed as the trustee. And being a trustee can be a full-time job. Does an individual have the time to dedicate to it? And the trustee can be a nonprofit such as Plan.
Yeah, so in the case of Jane, originally, even though her parents set up the future funded trust, they had left it to a family member. And at the time of her mom's passing, the family member that she left as trustee, or as she named as trustee, had a lot of her own health issues and just felt like physically she just couldn't manage the trust anymore. So she shopped around and she spoke to several different trust companies in the state, and she actually chose Plan specifically because of the service coordinator piece.
Okay. So features of a special needs trust with Plan, we require no minimums. We offer support through our staff of knowledgeable, experienced, compassionate social workers who follow along with the beneficiary and are often with that person throughout the life of the trust. So part of, we skipped a slide, but part of the, by using a professional trustee, the responsibility is shifted from a family member to an individual here at Plan. So Plan offers an all-inclusive model, which is you pay a one-time fee, and that pays for the investment of the funds by a professional money manager. We have prepared all of the tax documents related to the trust, annual accountings, and service coordination, which is the most important piece.
So there are some people who have thought about doing future funded trust, and there are occasions, and Joan and I have had this conversation with families, and you don't have to, but some families at the end of the day decide that maybe they'll start their third party trust with a small amount of funds, just so that the beneficiary is used to the trust and the service coordinator that's going to work with them. So it's just not a shock. And then that way we also get to know our beneficiaries, and that's really important to us, to know who our beneficiaries are, what their interests are, what their needs are, and making sure that their needs are being met. And then kind of looking at what's going to improve their quality of life, what's really going to enhance their quality of life. And, in Jane's case, she loved music, and we were able to coordinate getting her into a music program. We had another beneficiary that was, his coping mechanism was actually his artwork. So we made sure that he had all those art supplies and the ability to carry out his artwork. And we're fortunate that we have some of that artwork hanging in our office.
So these are examples of things that Medicaid won't pay for. So the trust that is set up can pay for it. It's to supplement those needs. So if you've decided you want to move forward and you've vetted who the trustee will be, and in our case, if it were planned, how would you get started? You would, in fact, reach out to us directly. What we do is someone reaches out, they ask as many questions as they absolutely would like to ask, because we understand that it is a lot of money and it's your loved one or yourself, and you want to make sure that it's done right. So we encourage people to call us as many times as they want and ask as many questions. We hope that you'll start with the website. We will get some answers, but we understand that you may want to speak to a social worker and really get an understanding of how this can help you.
And we don't charge for those phone calls.
We never charge.
We know that this is a huge decision for people. So
yeah,
you can call as often as you need so that you feel comfortable with the information.
So if at some point you decide, I'm ready to move on, we do have an online application, which you would see in the website. Once the application is completed, funds are deposited into the trust, a service coordinator assigned to the trust, and they'll work with you to put together a spending plan.
So those spending plans, they're just a guide. It looks like a budget, but it's just a guide so that we can plan not only for investments, but for needs. That we want to make sure that it's going to stretch the life of the trust and that people's needs are going to be met. So, but things change, and that's updated on a regular basis as well.
Okay, so I guess we have some questions that have come in. Is there an age range to start a special needs trust? Can someone 62 years old start a special needs trust? So no one, there is no age restriction. So the answer there should have started with yes. You can fund a trust at any age with plan. In Massachusetts and Rhode Island, you can be at any age, although as we mentioned, If you're over 65, it needs to be with a pooled trust. So you have to have a nonprofit be provide the trust administration. How bad does the vision of the recipient of the trust need to be? So if you have a documented disability, or you have a disability, I should say, that's all you need to do. That's all you need to have. We don't have, how bad is your vision? So SSDI needs documentation. SSI is means tested. So if you tell us that you have a disability and you fill out all the paperwork and you can, and we ask what the disability is so that we
Yes.
can appropriately provide the services that you might need. Do you want to take the next question?
So how do you plan if you are unsure whether a trust is needed? That one option is establishing that future funded trust, because it's not funded, but the vehicle is there if and when the time comes that you decide that you need to fund it. I mean, I think as Joan talked, about people having to worry about how they're going to retire and take care of themselves. That's something that you'll decide as time goes on.
Yeah.
And how to save money without going over the limit allowed to collect SSI benefits. So there would be several options, and I'm not sure if everybody has ever heard of ABLE, which is Achieving a Better Life Experience. And it's managed by Fidelity and MEFAR, and they're set up like the 529 college accounts.
Yep.
You have to have been determined disabled prior to the age of 26. And then there's, limits on how much money can go in there. So it can't be more than the IRS gift tax rate per year, which is still currently $15,000.
Yep.
Right. And the funds in your ABLE account can only be used for a qualified disability expense. So there are certain limits with benefits like SSI, the supplemental Social Security income. If a special needs trust paid for rent or food or utilities, the Social Security would call that in-kind support and maintenance, and potentially the SSI benefit could be decreased. However, you could use your ABLE account to pay those things. Going on a vacation is not considered a qualified disability expense, so your trust could pay for that. And your trust could actually put funds into an ABLE account. There are people who, have periodic deposits into their trust. So for a first party trust, there's people who have their alimony or child support payments go in there so that they keep their assets down. And I think more importantly is meeting with a financial planner.
Exactly. And so what happens if you're working, Kathy? And, can you put money into your ABLE account?
Yes, you can put an additional $12,000 in annually, but once you hit $100,000, your benefits will be suspended. You won't lose them, but they'll be suspended. You can put as much as you want into a special needs trust. It's never going to impact your benefits. If your ABLE account hits $500,000, you will lose your benefits. ABLE has what they call a clawback, which means that from the date that the ABLE account was established, there's a Medicaid payback for that. In a third-party trust, there is no Medicaid payback. So whenever you fill out the forms, there'll be a section there that will tell us if something happens to the beneficiary, where you want those funds to go.
So there are a lot of options, and we realize that we've thrown a lot at you. If you have questions, feel free to call us, reach out. We'll try and answer your individual questions. So as Kathy mentioned, we talk about financial planning. We have a partnership with Financial Planners of Massachusetts. If you need names of a financial planner, we'd be happy to try and get some for you.
Mm-hmm.
We always encourage people to use disability attorneys or elder law attorneys. They're all skilled in disability law.
Which is very unique.
Yes.
If you fell and broke your leg, you wouldn't go to your eye doctor to get it fixed, right? You'd go to somebody who specializes in bones, and attorneys are actually the same way. You really need somebody who specializes in this area.
Right. So again, we would be happy to give names of attorneys that we work with. There are at least 400 people that we know of that would be able to help you in whatever location you're in. And we usually give out 3 names of people so that you can follow up with those people. Do we have any questions at all? No, okay. So this was a quote from one of our beneficiaries. Kathy knew him well, and you can see her smiling. Your act was not just a gesture of kindness, but also of human understanding of the human condition. The knowledge that all of you understand me has moved me deeply. And we strive very hard to make sure that we have a positive impact in everybody that any person that we deal with. So again, give us a call if you need to reach out to us. There is, of course, no charge. So I guess we have a few minutes. We're early, so we'd be happy to let you all enjoy the rest of your day.